You may not always know if your child has earwax or not, but there are some signs occasionally. So you may see some residue around the edges of their ears by the ear canal entrance. You may also notice that behaviourally they are acting a bit differently, so you might see them pulling their ears, trying to relieve some of the pressure and make themselves feel a bit better and more comfortable. And you may also just notice a drop in their hearing, so they've become less responsive, they're not turning their head to sounds that they would have normally been startled by, they may not be responding to their name, or they may be wanting the telly up a little bit louder, or they may not be doing so well at school. The safest way to clean a child's ears is to make sure that you don't push anything down inside the canal. It's very tempting to reach for a cotton bud, especially with a baby. However, they were never designed for ears, and they're actually too large to use inside an adult's ear, never mind a child's. So the best thing to do is to keep an eye out for any wax residue around the edges of the ear canal, and just gently wipe away with a soft cloth. And also you can use Earol olive oil baby spray, which may help to maintain and keep the ears clear of wax. The presence of wax may cause problems in us spotting that there's an infection there, because we can't see beyond the wax, so we can't check for the usual signs of infection like redness, swelling, discharge, or even perforations. So we could do with the ear being as clear as possible, really, to make sure that we can check for the health of the ear. The other thing is, sometimes when somebody does have a buildup of wax, that may actually encourage infection to occur, particularly if any water can find its way around the edges of the wax and behind the wax. It can set up a bit of a stagnant pool, which can encourage the growth of microorganisms like bacteria and viruses. One of the impacts of hearing loss on children is that they may not be able to learn how to speak correctly. They may not be able to develop their speech as they should do, because they may not be picking up all of the key elements of words, such as the beginnings and the endings of the words, which means that they may not be able to speak as clearly as possible. So this affects mainly our sort of preschool children. Going forward, if they're not hearing speech properly, then this can then also affect their actual education as well. We recommend using Baby Earol on your child's ears if we know that they're prone to a wax build-up, or if they wear hearing aids, at least every 3 to 4 weeks, to try to keep the wax moving in the right direction and out of their ear. It's worth being aware that if a child does have a build-up of earwax, they may actually be feeling very uncomfortable with it. So they may be pulling on their ears to try and relieve the pressure, and it may be masking an infection that's hiding behind the wax as well. So please look out for signs of temperature and any distress.